Hello, Dr. Vikki Petersen here. I wanted to speak to you today about autoimmune disease. This is a really important topic because the incidence of autoimmune disease is just skyrocketing in our country. And the link between autoimmune disease and gluten is actually very strong, and it's something you really should know about. You won't hear this in mainstream media. You won't hear it in mainstream medicine. But the research is there, and that's what's most important. And the clinical evidence is there, and I can tell you in our practice the evidence is there. So here's how it occurs. There's a substance called zonulin. It's kind of a strange name, but it's something that the human body produces, and by the way, no other mammal produces, and no other mammals other than humans get autoimmune disease. So there's an interesting correlation there. So that's point number one that's very important to know. The next thing is that zonulin, this substance, is produced as a result of gluten consumption or the presence of bacteria. Those two things are the only thing we know that causes it. What zonulin does is it creates what's called a leaky gut. And we can go into detail about how leaky gut is associated with autoimmune disease. That's for another video. But suffice to say, those two are very strongly linked, and research supports that. So the real key is, if you don't want autoimmune disease, you don't want a leaky gut, good. You don't want zonulin produced, okay. So, and what produces zonulin? Gluten and infections. So we can talk about infections as well, but let's focus on gluten for right now and the specific research that's rather new research, so it's exciting. End of 2015, Dr. Barbara and his team out of Italy, and what they did was they measured zonulin production in celiacs. They found it was 5 times normal, which was expected because celiac disease is not only an autoimmune disease in and of itself, but obviously it's associated with gluten. And so we knew that association, and we knew zonulin was produced as a result of gluten consumption. But we really didn't think that zonulin was increased in any other types of diseases other than, as we said, certain bacterial infections as well as gluten in celiac, so people who had autoimmune disease. So it was surprising and very interesting to find that the patients that they tested, the next group, was a gluten sensitive group. So these were defined correctly as patients that reacted poorly to gluten, felt better when they didn't eat it, but did not have celiac disease. So they did their due diligence in weaning out this group. And in that group, they had 4 times normal production of zonulin. So very, very close and very, very elevated, showing that not only are celiacs at risk for autoimmune disease, but so too are patients who are gluten sensitive, which is exactly what we've seen in our clinical practice for years. And I always was at odds with statements and research that said, no, it was only celiacs that had this increased zonulin production. So this research was exciting for me to see because it really corroborated what we see in our practice. And then the last group that they looked at were patients with IBS, primarily of the diarrhea sort of IBS, which is very common, and they had double normal, so twice the amount of zonulin production. We find a tremendous amount of patients with IBS problems have gluten sensitivity, so they were really all revolving around that same group likely, but IBS, gluten sensitivity, and celiac were the 3 groups. And the takeaway from this is really the importance of finding out, are you reacting negatively to gluten? Because if you are, and you're not eliminating gluten from your diet, every time you consume gluten, you're going to get increased zonulin production to a large degree, and you're going to create a leaky gut, and that leaky gut will set you up for autoimmune disease. So if you need any help finding out whether you have celiac disease or gluten sensitivity, it can be difficult. I mean, we miss about 90% of those suffering because it's not that easy of a test. If it was a super easy test, then everybody would do it and we would know absolutely whether we had the problem or not. So I hear from people all over the world, asking for help and trying to figure out if they have this problem. So if you need help, definitely let me know, reach out. That's what I'm here for. We are a destination clinic. We see patients from across the country here in the U.S. as well as internationally. So autoimmune disease is something that I really feel can be avoided. We have reversed it in our clinic. We have stopped it from getting worse. There's all the gradations in between, and it's really something you can do something about, and that's my message for you today. Feel free to let me know if you need anything, and until next time, I wish you very good health.